Hi again, everybody, and welcome to another edition of Around the Town with Chuck. My name is Chuck Guglielmo. It is a weekly interview show where we talk with interesting people around the community. And my guest today is from Chiropractic Care, Dr. Tyler Infield. Dr. Tyler, thanks for joining me.
Hi, Chuck. Thanks for having me.
Good to have you on the show. Went to your dad for many a year. Maybe I'll be coming to see you after we're done with this interview. But why did you choose chiropractic care?
That's a good question. So initially when I sat down to think about, well, what do I want to do with my life? I kind of sat there and I contemplated, do I want to be a radiologist? Do I want to be a medical doctor? Do I want to be a chiropractor? Kind of thought about all three, went to school, and then as I was going through school, I'm like, well, I don't know the medical side of things. I just know when I get hurt, I get adjusted and everything feels better. When I was in high school, I was in ski club. Miss Fazenbaker, if you're watching, that's an awesome program. Thank you. And when she did that, I would do a lot of jumps in a lot of the terrain parks and different things like that. And I would fall and, land in a bunch of different ways. And every day when I came home, my dad would adjust me. And I'd walk into school the next day and I'd see a lot of my other good friends that did the same things and had the same falls and stuff. And I was walking around a lot better than them. So that kind of set me on my way to say, okay, this is what I want to do. I've seen it work. I know it works. And this is what I want to do the rest of my life. I want to help people and help them get better naturally. Mm-hmm. So that's kind of why.
Did you get any influence from Larry, your dad?
With me and my brother, because my brother's a chiropractor as well, we both he never really influenced us of a direction to go. He kind of just told us, do what you want to do and do what you like doing. So it kind of just marinated into us, I guess, to become chiropractors.
Now, Infield Chiropractor, of course, is at 193 in Kingsville. You also have one in Euclid?
Yeah, my brother.
So do you work out of both?
No, I don't like to commute.
Okay, so you're strictly in Kingsville?
Yeah, I'm strictly in Kingsville.
And your dad's still, is he in Kingsville as well, or is he in Euclid?
He's in Kingsville going strong for 40 years and doesn't have any plans to retire. So.
And Paul's in Euclid?
Paul's in Euclid, yeah.
Euclid. Now, I know the one over here has been, in Kingsville, has been for over 30 years, or would you say 40? 40 years.
This was our 40th.
When did the place in Euclid open up?
That opened when me and my brother graduated in 2012. Probably got off the ground in 2013 and he moved once since because we outgrew the space. So.
Talk a little bit about your schooling, your education, your training. Start with high school and then work your way up.
Okay, so with high school, I just kind of, got my Edgewood Senior High School. Mm-hmm. And then from there, I went out to Edinburgh, which I figured, well, I want to go to a place that has a ski resort close. So I worked as a lift operator during my college years. So then I kind of became a ski patroller now. I do that as a hobby. So, and then after that, I did 3.5 years there, and I worked on my doctorate as I completed my undergraduate. So I essentially trimmed down an 8-year program into 6 1/3 years. So then when I went out to Davenport, Iowa, that's the fountainhead of chiropractic. That's where chiropractic was founded by D.D. Palmer in 1896. Year, either 6 or 7, and then after that, I went through the schooling. First year was kind of basic sciences, and then they taught you how to get hands-on and actually physically doing the adjustments, palpating and finding what you're doing. You did clinical diagnosis, and following that, you had a year of clinical rotations before you actually graduated. After you did your inpatient, which would be like the student clinic. After we did that, you had the chance to go to the outpatient clinic, and then following that, you had the chance to do an internship, or you could stay within the school. So I stayed within the school, and then when I got out, I came back and started working.
Very good. How much did you learn from your dad?
I've learned a great deal throughout the years working with him. When I came back, when you're in school, they tell you your first year in actual practice is when you're going to grow the most and learn the most. And I learned a lot from him in that first year, just of how do you treat people, how do you take this and do this. You learn it in school and you get the whole picture and you take everything, but there's a difference between being in school and having a textbook and seeing a person in real life and saying, well, what am I going to do with this guy? So it's a little bit different, but it's the same game. It's just you gotta transition from you're a student to you're a doctor.
So patients that come to your office, do they have to have a referral from an MD?
No,
at
they
all?
do not.
They do not have to have a referral. And when they come to your office, say a new patient's coming in, do they request if they want you or your father, or do they get who they get?
Either way. If they request one of us, they'll get one of us. So say you want to come in and you want to see my dad. You just say, or if you've been my dad's patient since 1977, then obviously you're going to go to him. But if you don't really care, or if it doesn't matter and you're a new patient, then we'll filter you wherever you work best in the schedule. And then some people do switch between us. So for some things I might see somebody, and for other things my dad might see him. So it all depends on kind of the patient and how we want to direct the care.
From what I read and study and everything, most chiropractors focus mainly on the spine, but you work on all other kind of joints as well.
If it's a joint and it can move, we work on it. I am actually a certified chiropractic sports physician, and I got that accreditation through the American Chiropractic Board of Sports Physicians, and I'm working towards my diplomate through the American Chiropractic Board of Sports Physicians.
I saw that on the internet. Matter of fact, you stole one of my questions.
Sorry.
You just passed that, right?
So with that gave me a ton of more extensive training in the extremities and extremity care and a lot of the different injuries that you see in sport. And then you can kind of take any sport and really think of it as, well, what is it? Because in our general population, we get a lot of factory workers, a lot of people that do a lot of repetitive activity. So you take the sport and you kind of manipulate it to how you want to work on that person. Well, I can't tell you how to change something if I don't know what you're doing throughout the day. So sometimes I'll even have people take pictures of their workstation or videotape themselves at their jobs, because then that allows me to get a better picture of everything and encompass the whole condition.
Would you say, Dr. Tyler, that most of your patients that come in are either with back issues, neck issues? Are those the two leading things?
Yes and no. I get a lot of wellness people because they understand it and they get it. I get a lot of people that have a knee that went out that caused their back pain. So it's connecting the dots. It's, how did your back get this way? Was it you shoveled and you bent over at the waist and then you chucked? That's okay. Then we understand that that's a back. But did you have a bad knee in high school that now is causing the lower back pain? So do we need to correct that knee from high school that kind of was corrected, but then you stopped doing the exercises on the side, and now it's translating into the hip and the low back, maybe the mid back and the neck too. So you got to see the whole picture, and then you got to correct it from the top.
People can come in for a lot of things. Been doing some reading. People that have headaches can come in.
Oh, we
What
kill
do you
those.
do for headaches?
By adjusting the cervical spine. There's a lot of different types of headaches. There's tension headaches, which comes from more or less the trapezius muscle and the different musculature in the neck. You can have some sinus headaches, some other headaches that are present. And a lot of times, I'll get a patient that gets headaches and I'll be like, so how much water are you drinking? Well, maybe a bottle or two. Just by increasing your water, you can kill some of those headaches, which is nice. But
No, there's something I learned. So stay hydrated.
stay hydrated. There's a lot of people out there that are not hydrated, including myself some days. So, but that makes a big difference. And then by obviously adjusting the cervical spine, because when every muscle is attached to each other essentially through the fascia that connects the different tissues. So as it goes down throughout the spine, and everything's pulling, it's going to pull on the dura mater in the brain. So when that pulls tight and taut, it's going to pull from the front and pull back. So by adjusting the spine, we can relax some of those muscles down and decrease a lot of that tension.
So before you perform these adjustments, you look at x-rays? You take x-rays there, right?
Before I perform any procedure on any patient, I am doing a complete neurological and physical examination with orthopedic testing as well. If x-rays are indicated, I will order x-rays. If I think you need blood work, I'll order blood work. If I think you need a CT or MRI, I'll order a CT or MRI based on what you need.
Is that all different from 30, 40 years ago?
No, we've always been able to do
the
it.
neurological part of it.
We're doctors of chiropractic, so that gives us that certification to be a doctor. So we can order whatever we want to order. As long as it's clinically indicated. I mean, you can't just go order tests that are not needed because that's cruel and unusual to the healthcare system.
Right. When the patients come in, like you said, they can pick whichever doctor they want to pick. Do you find the younger ones, the younger people that come in, do you find them wanting to go to you?
It all depends. I mean, you get some people that it doesn't matter. All people care about is three things. How much is it going to cost? Can you fix me? And what's wrong with me? If you can answer those three things, you can help a lot of people. And a lot of the times, if I notice something on the first visit a lot different, I will take the person into the office and say, look at this. This is normal. This is how you are. And they'll be able to distinguish that, and I'll be able to show them. Because if you don't tell the person what's wrong with them, they're never going to be able to know what's wrong with them, why they're like that, and how they can fix it. So.
About costs that you're talking about, insurance, do you take most insurance plans?
Yeah, we accept pretty much all insurances. My dad's done a great job with that throughout the years since he's been here so long. It was super easy for me to get on all the plans as well.
I know when I went there years ago, they had a great staff.
Yeah. You might remember Julie.
Julie, yep, one of my favorite girls.
She's been there, I think, 37 years now.
Oh, easily. I know she remembers Julie. We both went there. Yeah, she's a good girl.
Yeah, she is.
Yeah.
She's a very good girl.
How do you stay current in the new therapies that are out?
That's where my extensive training and everything like that comes into play.
Are these new to Larry as well?
It all depends on if you want to get the certification or not. We are required to have 32 hours, either 32 or 36. I don't know. I well exceed them anyways. But I think it's every 2 years. I've had over 250 in the last year. So wow. I mean, when you look at it that way, it's a little bit different.
Yeah.
I look at it as I don't need the training. I want the training. So when you want it, you never really have to worry about how many credit hours you need. And I kind of look at my practice like that. Is if I think taking a seminar is going to benefit a patient, I'm going to take the seminar to help that patient. So.
When we talk about chiropractic care, mainly we're looking at adults, but how about children? Do they ever come in for chiropractic care?
Absolutely. I have one girl, and her mom probably knows. Well, if she's watching, she knows I talk about her. But she was colicky when she came in. She came in when she was like 2 weeks old. We completely cleared up all the colic. Doesn't really have any issues anymore, and she does really well. So, and I still see her regularly every month. So she comes in, she gets a sticker, and leaves.
So you do see children? I
do, absolutely. Yeah, you can adjust anybody with a spine. I say 2 weeks. To whatever, 105, 111, whatever you want to say.
You talk about the importance, not only when the patients come in for treatment, you talk about the importance of staying hydrated. Do you get into healthy lifestyles, and do they change their eating habits or anything? Does that play into chiropractic care?
It does. We have a nutritional program. It's all based on what the patient wants. I mean, when you come into any doctor, really, you kind of got to determine what are your goals going in. And a lot of the times I'll sit down with the patient and say, so what do you want to do? What is it that you can't do, and what can we make you do? Say you want to go skiing 5 days a week and you can't because your hip hurts. Well, let's start with 1 day a week and see what we can do, but let's get you better. Let's strengthen the muscles there. The other 4 days, you're going to be doing the rehabilitative exercises to get there. And that's really kind of what we work with is, what are the patient's goals? Okay, say you want to lose weight. Well, let's see how we can get you there. Let's implement a diet plan. Let's have you stick with it, and that's your part. Are you going to stick with it or not?
So that's extremely important, not just the treatments. I mean, you got to do that other stuff too.
Absolutely.
And then, trying to remember when I went, when you get those treatments, you get exercises to do at home as well.
We have a lot of different exercises. I have a whole rotator cuff protocol, so any issue with, the supraspinatus tendon or any other tendons that are comprised of rotator cuff, the teres minor, the infraspinatus, or the subscapularis, we can work those muscles, isolate those muscles, and fix the problem essentially. We get a lot of hip labral tears. I get a lot of shoulder labral tears. I get a lot of that because that's what I'm trained in. I'm trained to treat and manage those. Occasionally, we'll get an elbow or a numb toe. That's happened before.
We were going to go joint to joint from head to toe here.
Right.
So let's talk about low back pain. Many people have lower back pain. I have that as well.
Absolutely.
Especially in the morning when you wake up. And like after an hour, maybe not even an hour, you don't feel it anymore.
Right.
Do you recommend chiropractic training for that?
I always recommend chiropractic to everybody. Yeah, I'm a little biased because I'm a chiropractor, but I've been getting adjusted ever since I was a kid, and I understand the value of it, the benefit of it, and I understand that when I wake up in the morning, I have no pain. At the same token, I'm also, 29 years old, but I've also had injuries along the way. Separated my shoulder. My patients know that one. That was fun. Still went into work every day afterwards. But there was a lot of different injuries that I've encountered that I should have problems with, but I don't because I've been getting adjusted and recorrecting those biomechanics every time I've had an issue. Thank you, Dad. But, a lot of the times I will adjust a person and then I'll give them some stretches and say, do these before you get out of bed. They'll do them before bed and before they get out of bed. And usually that takes care of the problem a lot. I mean, you can't say that for everybody because there's a lot of underlying issues there. And that's where the x-rays and ordering the further testing and doing the proper evaluation to know the problem goes.
Talk to me a little bit, Tyler, about sciatica. Now, sciatica, I believe, can go down your leg.
Yes.
And is there treatment for that from a chiropractor?
Yes, sciatica is a blanket term essentially indicating leg pain, okay? I like to think of that more of a non-organic word because it doesn't just, there's a sciatic nerve and it runs through the piriformis muscle, and sometimes I'll give people stretches to stretch the piriformis muscle. But when you first come into my office, you're going to tell me you have sciatica because that's the term that everybody knows. What I'm looking for is it because of a compression at a higher level? So is that at the L5 nerve root? Is that at the L4 nerve root? So as you come down and you look at the spine, what it's going to do is kind of branch out. And as it branches out, so say your spine's here, it comes out and down, and then out and down. And then all those nerves are going to intertwine. As those nerves intertwine, the sciatic nerve branches off and goes down the leg. If you guys are at a computer, just look up the lumbar plexus. That'll show you how the lumbar nerve roots branch off and create the sciatic nerve. So anywhere along that way can compress that sciatic nerve. So it's just kind of a blanket term for leg pain. So by adjusting you, we will be able to correct that based on what nerve root is affected.
So that's good to know with sciatica nerve that chiropractors can help get that better.
Yeah, and if you look up just lumbar plexus, it'll show you. And then same with the arm, it's brachial plexus. So there's just a whole neural network. It's your body communicating.
Bulging disc.
Yeah.
Define it. And what
That's
can you do
essentially
for that?
when you have two lumbar vertebrae and then you have a disc in between here. When that pops out a little bit, it compresses on that nerve root. As that compresses on the nerve root, then that's going to send the pain out. So just like we were talking about the lumbar plexus, when that L5 nerve root is compressed on, what's going to end up happening is it's going to impinge any nerve past that point. Okay, so that's why people are going to get the radiating pain down the leg. That's why they might get numbness in the back of the leg or the side of their leg. There's dermatomal charts that map out every part of the body as far as where those nerves are going to go. So a lot of times people come in and say, I got numbness here and it's extending here. Well, you just showed me where Texas is on the map. Like, that's L5 nerve root because of a bulging L5 disc, possibly. There you need an MRI and a little bit more elaborate studies to detect that. But pretty much when you come in, that's what we're going to evaluate and treat. I have a good friend that came into my office and he told me that same story. And I'm like, okay, you got an L5S1 nerve root disruption. And he's like, okay, whatever that means. We ordered the MRI, came back, and I was right. And that's it. Your body maps it out for you.
Sure.
You just got to know where to look.
So a bulging disc can create all kinds of things, numbness in feet, toes too as well?
Absolutely. So there's a lot of different things that...
I guess. Now,
Because there's a lot of different pathways that nerve has in it. So if you think of a nerve, I mean, you can break that down into sensory, motor, and afferent, so going back essentially.
true or false, sciatica, when you do have it, it can only be in one leg, not both at the same time?
It's going to be more of a central canal stenosis if it's both legs.
What does that mean?
That means the spinal cord is going to be pinched, or both nerve roots are going to be pinched because you have a disc that's bulging backwards into the... So with the vertebra, I should have brought a spine. You have the spinous process, you have the facets, and you have the vertebral body. And then you have the foramen magna. So when you have a disc bulge that compresses backwards, it's going to push and compress both of those nerve roots. So there's a possibility there. It's kind of like when you get somebody who's paraplegic or quadriplegic. When you sever the spinal cord at a certain level, if you sever it, from here down, you're going to lose your legs. If you sever it at the neck, you're going to lose your arms and your legs because that spinal cord's been cut off, essentially.
This is good stuff you're giving us.
That all depends on kind of where it's at and what it's doing. So yes, it can be sciatica, but I would like to think of it as a bilateral lumbar radiculopathy, meaning it's a lumbar problem that's going down both legs.
This is great stuff. What about a herniated disc?
Same thing.
Same as a bulging disc?
Yeah.
Just call it something. Why would they be called two different names?
It's just one's a layman's term and one's more of a... And you can have mild and... you can have a mild disc bulge and then a prolapsed disc. So there is a little bit of difference there. So a mild disc bulge means you have... I have a picture of this in my office. So if you think of this as a disc, you have here, this is your annulus fibrosis and then a nucleus. The nucleus is a soft part. So if you have a little bit of a protrusion with the annulus still intact, that would be more of a bulging disc, okay? If we break that annulus and then the nucleus kind of produces out, that's going to be more of a herniation. So
Okay.
I guess there is a little bit of a difference, but it's
But basically the same.
the same thing, yeah.
So as much as that bulging disc, herniated disc can lead to leg problems, feet problems, problems with the back and spine can also lead to neck issues?
If it's in the cervix, it depends on the area of the spine you're working on. I mean, some people have neck pain, and that kind of is a whole different box of worms, because if it's down the arm, then we're thinking about a cervical radiculopathy there because of a disc herniation in the cervical spine. If it's just kind of going into the shoulder, then we're thinking, well, there may just be a lot of tension in that muscle. The muscles can pull tight because of different things that you're doing. Say you're pulling all day with this arm and not using this one at all. This one's going to develop a different motor pattern than this one, and this one is going to kind of grab a little bit. So it all depends. But then that goes back to, well, why do you have to do an exam when I call your office to come in? Because we don't know. I can't evaluate you when you're walking down the street. However, I did have a patient the other day walking into the post office, and I was watching him because I was stopped at the stoplight in Kingsville, and I'm like, I never noticed that. He was walking with the lower right hip, and he's dropping his hip a little bit. I'm like, okay. So when he came in the next time, we talked about it. I'm like, I was spying on you. So
I remember when I went to your dad before, he would always say, like, one of my legs were shorter than the others.
Mm-hmm.
Don't remember why that is. Why would that be?
Some people are born with a congenitally short leg, meaning you're just born with it. Other times, your hip might be higher than on one side than the other. And then you can always add different things that play a factor. Maybe you had an old meniscal injury in high school. Maybe you've had 1 or 2 knee surgeries. Maybe you have a hip that was different when you were younger, so you have a skiffy.
Anything in the back could cause it?
It can, yeah. Because what we'll see is you can see people when they're walking, if they've had a herniated disc, they'll kind of bend forward, lean to the left or the right, depending on where the nerve is. So when they're like that, then that's going to shift the whole hips and everything, yeah. And that's where kind of we come into play too, because you're walking around like this now, so you can walk around like that the rest of your life, or we can fix it and you can walk straight up. And that's where the hips are going to go out of line. You're going to develop a high hip, a short leg, different things like that. And that's really what we're trying to fix. But if you ultimately have a congenital short leg, you're always going to have a little bit of short. And people typically tend to be shorter on one side than the other. That's a normal.
Oh, that's typical.
Yeah, that is.
I didn't know that.
Yeah, that's a typical variant.
Okay. How long does it take you to work on a patient? I don't mean in a visit. I mean to correct an issue, a pretty serious issue. How many times how many treatments would you have to administer?
That all depends again on the patient. But when you think about it, if you go in for a surgery, you're going to have the prehab on that, then you're going to have the surgery, and then you're going to have the rehab. So you think about that 6 to 8 months, maybe a year, whatever it might be. We can get you feeling a lot better in about a month or two, but at the same token, it's probably about 6 to 8 months before we actually fix and correct the whole problem, till your muscles have regained that memory, till the exercises are actually they're holding it where we need you to hold it, and they're working at their maximal benefit, and everything's evening out. So you're not walking around like all construed. But then you have people that have chronic conditions that I don't want to say they're never going to get better, but they're going to reach their 100%. Now their 100% may not be like my 100% or a 16-year-old's 100%. Their 100% could be maybe a 2 out of 10 scale. But it all depends on how that patient is, how chronically degenerated are they, what did they do, did they have an auto accident when they were 16 and they broke their hip, tore the meniscus in one knee, and whatever else, So everybody's a little bit different. It's how are we going to make your rehab the best for you at that point and fix the best that we can what we have. So we're taking you as you walk into our office and making the best you out of it. That's essentially what we're working with.
Have you ever heard anybody be a little bit leery? Have you ever heard anybody say they're a little bit leery coming to the chiropractor because they heard they crack your joints?
We get that a lot, and then I correct them and tell them we adjust their spine. But they're back in the day, there was a little bit of a push between the American Medical Association and the American Chiropractic Association. And that relationship's gotten a lot better over the years. And everything's kind of coming around, but people are starting to be more holistic and understanding. But we don't necessarily, those people, you just take a little bit more time, explain things a little bit better than you would have to on some people, I guess you could say. I don't know. It's taking the time and explaining things, but I like to think that I explain things to everybody that walks in my door. So, anytime you meet somebody and 5 minutes later they're running you through an exam and putting you in positions that you don't want to be in, you got to have a good personality to get through that. So a lot of the times I'll be cracking jokes when we're doing the exam and different things, but educating as well, telling them I'm doing this because this is telling me that the right L5 nerve root is being irritated, or different things like that. So I like to educate as I do the exam, so people kind of know what we're doing.
That really is probably the number one thing, is to make sure your patient is pretty well educated in what you're doing.
Education goes a long way.
Yeah,
so.
in everything really in life.
Absolutely.
But even in that particular area.
Yeah, and it's all communication.
Yeah. So. Some statistics I found from the website, 60% that you choose chiropractic care, less in hospital admissions. I found that's 6 out of 10. That's a high percentage.
Yeah, there's a lot of different things there. Typically people that start with chiropractic end up not having less surgeries. There's a lot of studies out there on it. They tend to have less surgeries and the conditions tend to relieve a lot better. We do cut down chiropractic as a whole. Our profession does a great job of cutting down on a lot of emergency room visits and different things like
These
that.
last two statistics are great. 62% less outpatient services. And the big one here, 85% less pharmacy costs.
Yes. Well, we're all natural, and we
Right.
try to do everything as natural as we can. So
That's
there's-
great.
There's a lot of benefits.
So where do you see chiropractic, where do you see it today versus what it was when your dad started out? What do you see it being tomorrow?
You know, there's a lot of battles, but I think on, and this is me personally speaking, because I've seen it work at a lot of different places throughout my career. But I think what it needs to be is everybody needs to interwork and communicate and work better together. I have no problem if it's cheaper for somebody to send them to physical therapy because their insurance will cover it opposed to treating them. But I still want to see them because I'm their doctor. I want to make sure that everything's going good. So, you know, I think that everybody needs to work well together, and we need to develop a team as a whole. That's really what I see when I see the different multidisciplinary things going together. My brother's done rotations at the United States Olympic Training Center, and I'm working towards doing those as well. And with them, you know, physical therapists, medical doctors, chiropractors, we all work together as a whole, and we get the whole picture and we figure it out. And that's really where I want to see the profession going, and I know out west it's going that way. Out east, it's getting there, but out west they're way better with it. That's why I go to seminars out west, because they have medical doctors speaking and everything like that. And they tell us we're doing good jobs. They tell us they know they're understanding what we're doing. But out west is way further ahead of the east. I will say that.
For people out there that are watching Dr. Tyler, that are thinking about chiropractic care, you got some contact information for them?
Yeah, we're on 6177 Lake Street in Kingsville, Ohio. Our phone number is 440-224-0680. And we do have a website address, www.infieldchiropracticclinic.com.
Business hours?
Okay, so Monday, we're there. I get there at 7, so we'll answer the phone. We surprise so many people with that. But we treat patients pretty much from 7:45 till about 6:30 at night on Monday and Friday. Wednesday is every day 7:45. So Wednesday is 7:45 to about 6. Tuesday I'm there from 7:45 till noon. My dad's there 7:45 till 4:30. And then Thursday I'm there 7:45 till 4:30. My dad's there 7:45 till noon.
Pretty well covered then.
Yeah, and then Saturdays by appointment only. So.
So you do have, if people need to come in on a Saturday, even if
Yeah.
it's a first-time patient?
We're usually there from 8 to 9 in the morning. So we kind of try to limit it to that just because we don't want to waste our whole weekend there. But there's some people that can't get in during the week, and we respect that. So.
So again, before we close, so if somebody comes in, like say I come in, and I've gone to Larry before, and now I come in, and let's say I want to try you because you're younger. Not,
Right.
you know,
right.
just because you're younger. Would that hurt your dad's feelings?
No, not at all. We've
I
actually
guess that's
talked
what I'm
about-
trying to ask.
No, I've thrown patients his way, he's thrown patients my way. It's just sometimes, you know, it's just a different angle, and he's shorter than I am, I'm taller than him. You can ask my wife. My dad does better anterior adjustments on my wife than I do. My dad teaches me, and he's like, I can't, it's just, you're too tall. So there's different things there in the different angles. So there's no offense to it, it's just, you know, that different angle that day or that time works better. And there'll be times where I'll call my dad over and I'll be like, Dad, look at this for me. And he'll be like, you know what you're doing? I'm like, I know what I'm doing, but I want you to do it. And just that little bit of change in angle or change in direction makes all the difference. So if I'm not, every visit I expect to see progress. If I don't see progress with somebody and I see regression, I'm not happy about it. So I'm gonna change care and do as much as I can, but keep it with the same care, but just a little bit of a tweak. And a lot of the times that'll make a big difference. So.
Dr. Tyler Infield, my guest today. Great stuff, Doctor.
Yep.
Appreciate you coming in.
Thanks for having me.
Dr. Tyler Infield, my guest today on Around the Town with Chuck.